third quarter training for Benicia emergency response teams focuses on triage and emergency medicine.
Can you hear me?
You can drink of water.
Okay. Can you stand up?
No, I can't.
Did you injure your leg?
No, I'm burned.
Oh, burned all over your body. Okay, I got it. You need
She's-
to get a glass of water if you can. And
Well, you're gonna do your assessment first.
So you send your rescuer to bring her a drink of water because she said she's very thirsty, and you continue your assessment. Your assessment should be an assessment of her breathing, respirations, her perfusion, and her mental status. So assess her respirations. She seems to be breathing with difficulty. She's coughing, she's struggling, she's breathing very fast. So you think that she may be having a problem with inhalation injury from the smoke or from the burns. The next thing you start checking is her pulse. Check her capillary refill, her perfusion. Her capillary refill is delayed. It's 4 seconds. You say capillary refill and the blood doesn't come back. What does that tell you now? She's cold. She's in shock. What are you going to do right away? You want to lay her down on a flat surface, elevate her legs, try to auto-transfuse her with the blood that's in her extremities. So we get her down on the floor, very gentle, avoid rough handling. Try to find some blood. Very good. Okay, so she's in shock. You don't want to try to give her water in this position. She may aspirate. The water may go into her lungs. So we elevate her legs. Very good. You turn around and you have a trunk full of equipment here. What do you see in the trunk that you might use to help you with treating her for shock? There's something in the trunk that you might be able to use. So you send your rescuer there and you find a blanket. You can take the blanket, you touch her skin. Her skin is icy cold. She's not circulating at all. She's in shock, so you cover her up. Very good. So right away, you've given her a blood transfusion by elevating her legs. You've started to treat her for shock. You've restored her body temperature. If the body is warm, the blood may be able to clot and stop the bleeding and cover all her burns. Very good.
immediate treatment.
So you've started to treat her for shock. So you did a very successful handling of this mega code with the toxic spill, and now the ambulance arrives. And what will you do when your rescue team gets here?
First, I need to remove this patient into the hospital.
Very good. You will tell them how many people you've tagged as red, how many you've tagged as yellow, green, and black.
Right.
Okay.
3 dead, or 2 dead,
She's got 2 dead,
and 2 were immediate.
2 were reds, and you had someone who was green who came and responded to
Right.
you. Okay, and you tell them where they are located on the scene, and you let the paramedics take over now. Excellent job. Scenario, this is an earthquake that has resulted in a building collapse. You can read the scenario on the slide or in your handout. And you're the first responder to the scene. You are responding to one house. There are several family members in this house, and some of them are covered with bookcases. Do we have some bookcases to cover them with? Maybe we can use these cardboard boxes. Excellent. And we have one victim who has some heavy material that is laying over his head. We have another victim here in the chair. Could you? Sharon has. So Sharon has found somebody over here who has an amputated part. The hand is laying on the floor, and Sharon is going to quickly tag this patient as a red. Excellent. She's going to tag this patient as a red, so her buddy is going to tag her, and she's going to instruct the buddy to do what with the amputated part.
Pressure. Put it in a nice
Okay. So we're going to try to control the bleeding by direct pressure on the wound, by putting pressure on the pressure point. Since this is in the hand, then the application of pressure on the brachial artery will be able to control this bleeding. So you've instructed your buddy to hold pressure on the brachial artery, and tie a bow around her arm so that would hold pressure, and your buddy could continue to help you with your triage.
Now, do I help the buddy go find a bandage?
Oh,
Or do I move on?
you move on to the next one, and you've told your buddy to correctly handle the amputated part. The correct way to handle the amputated hand is to do what? All right, so we find this hand laying around, and here is a Ziploc bag with ice. Should we put it inside this bag? Just turn to the camera. So we've got this hand and we've got this bag of ice. Are we going to drop it in this bag of ice? Yes? No? No, we don't want. Very good. We don't want this to freeze, because if it freezes, it will cause further damage to the arteries and the veins and the nerves in here. So we want it to be cool, so we'll lay it on the top. If possible, we'll find a piece of cloth. Do we have a piece of cloth? We'll find a clean piece of cloth and wrap it around this. If there's any obvious debris here, we'll rinse it off. Okay, good. Should we take this hand and keep it somewhere away from this victim so it doesn't gross her out? Keep it with the victim so that when the victim is transported, the hand will be transported at the same time.
There's no ice available.
Just the best you can, keep it with the victim. So now we've correctly handled this victim, and now you move on to the next one. So Sharon is moving along. There's one victim wandering around on the scene.
Hi there, how are you doing? Okay, why don't you go right outside here and have a seat right here.
Okay, so Sharon has identified there is a victim who's walking around who has, pardon me, your victim 4?
Yeah.
Your victim 4. You're non-injured.
Yeah, shouldn't
Okay.
that help? I'm
Sure, she's
walking wounded.
Very good. So she asks this victim to come and step outside, but the victim says, there's nothing wrong with me. Can I help? Can I help?
Yes, yes, you can help.
Okay, so now you're with Sharon. The rescuer has correctly tied a bow around the pressure point so that she could open this bandage at a certain time. Is to control bleeding. So if you can put pressure on a bleeding point above the amputation, that would be very good, or direct pressure with a glove or gauze on the end of the stump if it's just oozing out, and if it's in a place we cannot. On the amputated part itself, if you wash it, keep it clean and keep it covered with a glove or with some cloth, that would be excellent. You do not want to put it in formalin. We had somebody bring in a whole bunch of fingers in formalin. They said that that was a preservative, and they happened to have formalin in their garage, and they put it in formalin. It is a preservative, and it will keep things in the state that it is, but it will not be in a live state for transplant. Depending on which finger it is, if it's the index finger or the thumb, and then depending on which level it has been amputated at, it may be a very important functional unit of the hand. Depending on the type of job they do, and if it's the right hand and they're right hand dominant, you can restore a lot of function by transplanting a finger. What about toes? If it's fingers and toes, should you transport fingers and toes? Yes, you can transport fingers and toes. Toes will probably not be transplanted back to the foot, but they can be used to transplant to the hand and use a toe to make a finger. So it's important to transport toes as well. So I have to tell you my amputation story. So I'm a third-year resident now. I made it past my first day. I'm sitting there as the junior trauma resident, and the EMTs call in and say, we have one person who's coming in. He was crossing the railroad tracks. It was 5 a.m. in the morning, and we're bringing him in. I said, sure. They said he's in shock, and he has some amputated parts, and we're bringing him straight up to the operating room. We're going to bypass the trauma room. I said, sure. So I have the trauma team waiting for him in the operating room. Here come the EMTs, and they have 5 gurneys. They said that they had only one patient. The first gurney contains the patient with the head, the neck, the chest, and the upper abdomen. That's all they have. He was crossing the railroad tracks, and it crossed over him and transected the lower part. The second gurney has his lower extremities, which are still covered with pants. The third gurney has his upper extremities, and then here comes the gurney with the rest of the clothes that they picked up at the scene. We find the legs, we find the arms. We can't find the hands. Where do you think the hands are? The hands were in his pockets. He was suicidal. He put his hands in his pockets and then strolled right across the railroad track. The hands were in the pockets. Very important to transport clothing as well. Some amputated parts may be in the clothing.
Chest injury and rib fracture.
I can't move my left side here at all.
Okay.
I can't move this arm.
So with his breathing, all right.
Okay, so you. Okay, he's breathing very quickly, and he's telling you that he thinks he has some rib fractures. It hurts him to take a deep breath. So you've determined that by exposing his chest and looking in there to see if there is any obvious sign of bleeding as well. Tag him as red because he has a critical emergent problem. He's not breathing very well, and he may stop breathing altogether shortly. So here is a victim whose head and upper portion of the body seems to be covered by very extensive fallen debris. You try to move it, but you cannot move it because it's very heavy. And when you do remove the upper layers, you see that the head and the neck seem to be massively crushed. What can you do now? Very good. As far as possible, check and see if the person is breathing. You can't really get to his head to do a look, listen, and feel, but you can get to his chest and abdomen, and you determine that the chest and abdomen are not moving. You check for a pulse, and you do a capillary refill, and you find that he's cold, has no pulse, and no capillary refill at all.